Hi, this is Angela with Angela's Nurse Toolbox. Let's talk about COPD today. COPD stands for chronic obstructive pulmonary disease. So when a patient has chronic obstructive pulmonary disease, what happens is their lungs are full with this trapped old air, which has a lot of carbon dioxide in it. And it makes it very difficult for this fresh oxygen to enter into the lungs and find a spot to where it can have exchange and get into the bloodstream. So this oxygen has very limited space because the carbon dioxide has taken residence and won't exit like it should. So if you think about your lungs as a sponge, when it's a good dry sponge, anything can go and blow through it. Air can go through the sponge. But when it's saturated with water, that sponge won't be able to take anything else on. For example, the oxygen won't be able to get anything else if it's full already with that carbon dioxide. So it makes it difficult for the patient to be able to breathe. They become short of breath, even with activity. So a lot of those patients, things that we use to treat it are inhalers. They'll tend to be on a lot of inhalers to help open up their lungs, okay, with steroids. And we put them on oxygen. A lot of these patients might be on oxygen at home. And it's important to only put them no more than 4 liters of oxygen, because if I give them a whole bunch of oxygens, their lungs feel that they got enough oxygen and then they won't be able to ventilate properly. So it suppresses their drive to actually take a breath. So we want to put no more than 4 to help the patients with COPD. If you like, subscribe to my channel. This is Angela's Nurse Toolbox.